the healthcare worker cleansing the venipuncture site, cleaning the arm, preparing for venipuncture. Venipuncture methods. Blood collection supplies should meet all safety regulations and reduce risk of occupational exposure. CLSI recommends venipuncture specimens be collected with a system that enables blood to flow directly into tubes. Winged infusion method or butterfly method. Patients with small veins, hand or wrist, pediatric, geriatric patients, patients having numerous needle sticks, patients in um, restrictive positions. So you use the butterfly. It's not just a needle that you use because you think it's easiest. There are certain times. There's a specific time when you should use specific time and specific situations when you should use a butterfly needle. Patients who are severely burned, patients with fragile skin or veins, patients who's specifically requested short-term infusion therapy. Here, you just picture it is a portable phlebotomy cart. That's all that is there. Here we see this healthcare worker still verifying this patient's identity. Performing venipuncture. Assemble supplies and check expiration dates and integrity of tubes. Put on gloves, position arm in a downward, slightly bent position. Apply tourniquet, select most suitable vein, cleanse the puncture site. We see this healthcare worker still cleans in the site. Remember, offer to answer any questions during preparation. Prepare all supplies according to manufacturer's instructions. Assure the needle is securely attached to avoid detachment during use. There's nothing more scary or more alarming than being afraid of needles and the healthcare worker, whom you consider to be a professional, fails to secure the needle, sticks the needle in your arm, goes to pull away, remove the tube, whatever the case may be, and the needle is still in your arm. That right there is what you call a lawsuit. If needed, use other strategies to improve vein selection. Allow the site to air dry. Do not blow on it. Caution patient that he or she will feel a stick. You don't need to be in there blowing on the sites, not birthday candles. Speaking of which, I've always found that to be one of the most like disgusting things on the planet. You're at a party, and I'm probably about to ruin birthdays for y'all because I'm pretty sure y'all never thought about it. You're at a birthday party, and the birthday cake comes out, and we're all standing around singing "Happy Birthday," and the person goes So now it's time for the person to blow out the candle. They're blowing their breath all over the cake, and you eat it. And we wonder why people get sick so easy here in this country. We don't know what this person's lifestyle is. What this person's been doing prior to them blowing the candles out on this cake. It's disgusting. So you definitely wouldn't want to do that same thing when we're dealing with a patient trying to draw blood from them. You want to blow your breath on them because the mouth is a breeding ground for bacteria. A lot of bacteria grows in the heat. Your mouth is hot. It's hot. I don't care how much you clean your teeth. Your mouth is hot. Okay. The most bacteria forms in your mouth at night when you're asleep, when your mouth isn't active. And you can clean it all you want in the daytime when you get up. But if you're not faithfully practicing proper dental hygiene technique and brushing like 3 times a day, it's very rare that people have time to do that. You normally get 2 at most, 2 times a day. And there's a lot of germs in your mouth. Point blank, period. So you don't want to be blowing on a patient's arm. The arm that you, with a site that you just cleaned to get rid of germs. Why would you feel like it's okay to blow on that site? Remove needle cap. Do not touch anything that would contaminate it. Hold assembly in one hand and anchor the vein 1 to 2 inches below the puncture site. Right? This is important. Because again, the whole point of this is we're trying to prevent needle sticks. So if you know where you're going to stick, if this person has been stuck in this arm multiple times and there's an indication where this person is stuck, you don't want to put your hand right there where the indication is trying to anchor the vein. No, that's the bullseye. This is not what you want to do. Hold anchor in the vein in the wrong spot makes you more susceptible to a needle stick, and that's why. Yeah, I promise I cannot stress this enough. Learn the steps for performing venipuncture and get comfortable with holding that needle in your hand. This takes time. Anyone can take a needle and put it in someone's body. That's not it. It's knowing how to maneuver when you have that needle in the vein. All right, that's where the problem comes in. You don't want to be moving the needle around that much. Now, granted, sometimes you may like hit the side of the vein and you may have to readjust the needle, but still, that's a slight readjustment. All right, you should not be digging in a person's arm. Most times, you don't even need to stick the entire needle in someone's arm. I see that a lot. You don't need to shove the needle all the way in the person's arm, all the way down to the hub. That is a no-no. Please do not do that. Please do not do that. I cannot stress that enough. Please don't do that. That is extremely painful. If you do it, you are rewarding of everything that follows that. If you decide to shove a needle all the way in someone's arm, it's like 2.5, 3 inches of a steel object that you're shoving in someone's body. Whatever happens to you after that, you pretty much brought it on yourself because that is uncalled for. All right. And so you don't want to be moving it around too much. And you want to make sure that you have a firm grasp on it so that if you have to reach over or under your needle hand to grab some gauze or band-aids or whatever the case may be, you are comfortable enough with limiting the movement of that needle. Because as you all will learn and see that when that needle is in your arm, you can feel that. You can feel it. All right, so we definitely want to minimize the amount of movement with that needle when it's in a patient's arm. Orient needle in same direction as vein and at a slight angle to skin surface, 30 degrees or less. 30 degrees or less. We're not stabbing someone. It's not a cake we're cutting. We're not screwing in drill bits. 30-degree angle, just enough, applying enough force to puncture the skin, get in the vein, and let that be that. 30-degree angle, that's what that looks like. Right. If blood does not flow, palpate gently above puncture to feel for the vein and possibly reorient needle slightly. Do not probe. This is exactly what I was just talking about. Keep needles stable as possible. Carefully push evacuate tube in the holder so that the blood can enter. Orient tube in a downward position to avoid possibility of backflow of additives into the patient, which can cause adverse reactions. And we just spoke about this in the last chapter. All right, especially if you see one of those tubes that has, like the yellow top tubes that we have in the lab, you can visibly see that liquid substance in there. You can visibly see that blood culture additive in the yellow top tube. You definitely don't want to risk having that flow into a patient's body. Here, notice how now, in my opinion, this is entirely too much tension on this needle. Entirely too much tension on the needle. If you look close, you can definitely see how the needle is starting to bend. Um, and that's because they are not holding it right. So we just talked about holding the tube in a downward position. So they're pressing down, they're holding the tube down against the bottom of the hub, and that's not what you want to do. It's not what you want to do. Please do not do this. Please don't. And this is why we practice on the fake arms for us to get comfortable in knowing how to navigate the needle into the vein, how to readjust. I said, I don't like that the arm is that old. I don't like that the skin isn't on properly. I don't like that the tubing is off. But I do find it to be a great teaching tool, so is that you can learn how to reposition the needle in someone's arm. Allow blood to flow into tube until it stops, which ensures proper dilution of blood additive. Watch carefully to see when the blood flow ceases. For multiple tubes, remove each tube from holder with a gentle twist and pull motion and replace it with the next tube. Simple. You don't need to go ramming the tube in the hub. Because again, the center part of that tube is rubber. The thing on that that gray line in the hub, that's a needle covered by rubber. So once you put that tube in there, again, there's a needle being covered by that little gray piece of rubber that you see inside the hub. Again, and the tube has a rubber center. So once you put the tube in there, you don't have to apply a lot of force because that needle is going to pierce that rubber top of that tube a lot easier than it's going to pierce your skin. So you please do not go ramming those tubes in the hub, because when you put the tube in with too much force, guess what you're doing? You still holding that needle in your hand, and you apply too much force entering the tube into the hub. Guess what you're doing? You're pushing that needle further and further in the patient's arm. Be mindful of that. You see, healthcare worker drawing multiple tubes of blood. Tubes or additives should be gently inverted for mixing. Apologies. A complete inversion means turning the filled tube upside down and then returning it to upright position. Most additive tubes require 3 to 10 inversions. Okay, 3 to 10 inversions. It's a friendly reminder. Blood cultures, yellow top tube, you're going to invert that anywhere between 8 to 10 times. Blue, sodium citrate, it's the additive. You're going to invert that 3 to 4 times. Red or gold top, all right? With or without the clot activator, you're going to invert that 4 to 5 times. Green, your sodium, lithium, heparin, you're going to invert those 8 to 10 times. EDTA, your purple or pink types, you're going to invert those 8 to 10 times. Your gray, your potassium oxalate or sodium fluoride, you're going to invert that 8 to 10 times. All right? Please make sure that you learn this, because under mixing or over mixing is going to have an adverse effect on the test results. Please make sure that you get this right. Again, neglecting to do any of these steps puts you at risk to lose your job. Point blank period. Point blank period. It may not happen the first time, but you can bet that at some point, if you continue to be negligent with the venipuncture process, inverting the tubes, people are going to notice that. So every time this person does venipuncture, their test results always come back out of range. It's not going to be, they're not going to look at the patient. Well, they're going to look at the patient first. But after they see that, hey, this patient has never had this problem, or this, that, and the third, or whenever someone else has acted with this patient and only seems to fall under your watch, then obviously you're the common factor, you're the problem, and they're going to get you out of it. All right. So again, it's imperative that you all learn these steps, learn these additives, learn the order of draw. It's imperative. I cannot stress that enough. For the duration of the time that we're in phlebotomy, you're going to hear this. Again, the order of draw, that's a great part of your certification. All right. Infection control, it's a great part of your certification. It's imperative that you learn these things. Following the steps is going to minimize the infections. Simple as that. And again, it's not so much as you just picking the book up and reading it, or listening to me say it, or seeing it done in the lab. You have to make the conscious decision that this is something that you want to learn. You know how you learn, how you prefer to learn. So you need to ensure for yourself that you learn these things. Right? Come up with a game, turn the Family Feud, tic-tac-toe it, whatever it is that you feel like you need to do. You need to make sure that you learn these steps, learn these inversions, learn these additives, just so that you don't run into any issues. Now, no one is perfect. Things are going to happen. Things are going to happen. All right? But we want to minimize the amount of times that these things happen. We can control that. All right? By practicing. Again, repetition is the father of learning. Me being a career service coordinator, I talk a lot about how people want to be associated with status. What are you bringing to the table? knowing the venipuncture procedure on like the back of your hand, being able to recite it forwards and backwards in your sleep, knowing the additives in the tubes, knowing the order of draw, knowing the proper that status. A lot people don't put forth the effort to learn these things. So you taking an extra 5 to 10 minutes a day to make sure that you learn this stuff, and you just not blowing, and it's not just something that you just blowing off, is going to make you stand out above the competition. Okay, you got to think your classmates are who you're going to be competing with jobs for. All right. So iron sharpens iron. If we're classmates, we want to make sure that our classmates are doing the right thing. All right. And if the people that at the company where I get a job for aren't doing things right, and I go in and I show them the proper way how things are going to be done, people are going to notice that. All right. And just like the example I just used, where we how they're going to look at if things only happen on your watch. It may be one of your coworkers who've been there longer than you. If they notice that things are happening on their watch, and maybe they haven't got rid of them because they haven't found anyone suitable to take their spot. Okay, so this is my classmate. I'm gonna go in and show them how it's supposed to be done. This person now, uh, the manager, supervisor, whatever the case may be, they're going to see that I know something, that I know what I'm talking about. And in the event that someone does, in the unfortunate event that someone does lose their job, hey, I have a classmate that knows just as much, if not more than me, that can come in and help out at this job. Okay, so when we have a lot of people on a job and everyone knows what they're supposed to do, that makes working that job 10 times easier. Then you won't despise going to work. Iron sharpens iron. All right, here you can see patient removing the needle. See them applying gauze to the site. Activate safety device according to manufacturer's direction. Discard the needle device. Continue general inversion of specimen tubes for complete mixture of additives with the blood. Do not shake the tubes. Again, because if you shake the tube, that causes hemostasis. You rupture those red blood cells. Again, that's going to have an adverse effect on the test result. Someone activating the safety device on the tube. They're using their thumb. This is something that I personally highly, 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 highly advise against, because you're putting yourself at risk for a needle stick. Just simply tap it on the side of the table, then close it. Do not use your hand. Please do not use your leg. I've seen that. People just go to tap it on the table, they miss the table, and because it's already down by their leg, they'll tap it up against their thigh. Boom! Now they have stabbed themselves with a needle in the leg that has someone else's blood and skin on it. Now all that has been transferred into their body. That's what a needle stick is. Right? It's not Needle sticks don't just happen on your hands and fingers. They can happen anywhere. Tap it on the side of the table. Feel like this picture should have been first. Dispose of it in the sharps container. See them inverting the tubes here. Apply pressure until bleeding has stopped, or ask the patient to assist. Apply a bandage. In patient's presence, label specimens appropriately using pre-printed labels or handwritten ones. You'll get these from your requisitions. So go and apply the bandage. This is them labeling the specimen. Ask patient to reconfirm identity of his or her blood sample by checking labels. Dispose of contaminated supplies and equipment. Double check to make sure bleeding has stopped. Thank patient for cooperating. This is the verification process. hand vein venipuncture using winged infusion or butterfly set. The rationale: winged infusions or butterfly needle devices are useful for venipuncture from smaller veins. Use of this system requires training and practice. Smaller veins require more care as the site is being selected and prepared. Hey, again, it's easier to stick someone whose veins who are highly visible and very prominent. That's easy. These when you're dealing with pediatrics and geriatrics on those veins in the hand, because they run so close to the nerves and arteries, you have to be extremely careful. Again, practice. Repetition is the father of learning. We're not just gonna just jump up and I got blood 10 times out of the arm, so I can. No, that's not what you're gonna do. You're gonna practice to ensure that you know what it is that you're doing. You're gonna have your instructor sign off. You're gonna work with someone to make sure that you know what you're doing, to ensure that we're providing the best care possible, minimizing is all the risks, and keeping the patient first. Here you see the healthcare worker identifying the veins in the hand. Here, just as seen in an earlier photo in part one of the lecture, you see how they're taking the index finger and they're moving the vein, and it's just showing how prominent the veins are in the hand. When site is selected, apply tourniquet, cleanse site with 70% isopropanol alcohol, position the needle at a slight angle to skin. Cleansing of the site. Hold needle by the wings to get closer and more precise insertion point. Insert needle at a slight angle, almost parallel to the skin. And we know when we're using the arm, we're going to go in at 30 degrees or less. When dealing with the hand vein, you almost want it to be right on top of the hand. But never let that needle, you don't want to just set that needle on the hand and then slide it into the vein. Because if you didn't clean the entire hand, what are you doing? You're contaminating that needle. Here we have the needle being inserted. The needle has been inserted in the vein. With needle in vein, blood begins to flow into tube and gently push specimen tube into barrel in same manner as before. Release tourniquet if it has been more than 1 minute. Tube in the hub. Holding it in a downward position so that the blood can flow into the tube. Removing it, placing the gauze above the site, over the site, and removing the needle. The needle has been removed, been retracted into the built-in safety device. So this needle here, this butterfly here has a built-in safety device. You can see that right here. That area is right there. Special considerations: the tubing contains air. It will underflow first vacuum tube by 0.5 milliliters, thus affecting additive to blood ratio. Fill a red top non-additive tube prior to any tube with additives. After the first tube, the order of tube draw should be the same. And we talked about this. For the most part, the red top tubes don't have any additives. You'll hear them being referred to, you'll often hear them referred to as the discard tube. That means we got to get the blood flowing, and it doesn't matter if we get enough blood in the red top tube because we're just going to throw it away. All right? Or if we're going to use it, because again, the red top tube does have test, has its own its own tests associated with it, but these tests do not require a lot of blood. So it's not a big ordeal if we do not fill the red top tubes to the fill level. All the other tubes, they must be filled to the fill level. Hold each tube horizontal or slightly down to avoid transfer of additives from one tube to the next. Small evacuated collection tubes should be used with winged infusion sets to avoid collapsing fragile veins. Not routine. The syringe method, not routinely used due to safety concerns, cross-contamination of anticoagulants in multiple tubes, use of excessive force to withdraw blood, or potential clotting in syringe can be useful in special circumstances. Veins that collapse easily, blood withdrawal can be gently controlled. So here you see the different parts of the syringe. You get the plunger, see the flange, the barrel, the hub, the safety shield for the needle, the lumen, and the shaft. All right, these are all the parts to the syringe. But these same parts apply to a double-sided needle. Okay? Again, this would be the needle. We know what our hub is. All right? It's the safety shield would be the thing that we take off right before we perform venipuncture. The lumen, the bevel. All right? Please don't be thrown off by the terms. Please do not let that distract you. Use same approach to needle insertion as used for evacuated tube method. Once needle is in the vein, take care to keep it stable while syringe plunger is drawn back slowly until required amount of blood is drawn. Take care to not accidentally withdraw needle while pulling back on plunger, and do not pull hard enough to cause hemolysis, which is the rupture of the blood cells or collapsing of the vein. I told you, I spoke with some of you all in the lab in the last couple weeks about performing venipuncture with a syringe, how you have to, this is something that you have to spend a lot of time practicing on, because you want to make sure that you have this technique down, because pulling it too slow can cause hemolysis, pulling it too fast can cause hemolysis, can cause the veins to collapse, can cause hematoma. A lot of things can go wrong if you're using a syringe. Not to freak you out, this is just something that you have to practice. Right? Collect the appropriate amount of blood, withdraw the entire needle syringe assembly quickly. Activate safety device immediately, depending on manufacturer specifications. Apply a sterile dry gauze pad to puncture site and ask patient to assist in applying gentle pressure. Remove covered needle attached to syringe and discard it appropriately. Apply After applying a syringe transfer device, immediately fill evacuated tubes using same order of draw as for evacuated tube methods of venipuncture. Right? I'm working on trying to get us some transfer devices, but these things take time. I kind of touched on it for those of you that were in lab the other day, how that works, what that procedure looks like. Fill each tube by inserting it into a syringe transfer device. Do not push plunger into to expel blood. Tubes will fill due to vacuum in the collection tube. Spoke about this. This is why you know when the tube is going to. This is why you never have to worry about getting the proper amount of blood in the tube, because the tubes are pressurized. As the blood flows into the tube, the air is being pushed out, so it's going to fill to the appropriate line or get extremely close. All right. Carefully watch as tubes fill until it stops, as this will assure correct ratio of blood to additive. Remove first tube and replace it with the next tube. Mix additive tubes by gently inverting them according to the manufacturer's instructions. After properly discarding used supplies and labeling specimens, check patient to see that bleeding has stopped. Apply bandage and instruct patient to leave it on for at least 15 minutes. If patients continue to bleed, notify a nurse or a supervisor. All right, just what uh, using a syringe, using a transfer method from using a transfer device with a syringe looks like. And this is what you should never do. Never put the needle into the tube itself, because again, you see how this person is holding the tube, bringing that needle down in a forward manner like this puts you at risk for a needle stick. And again, this we always want to try to avoid needle sticks at all costs. Um, Failure to collect blood from a venipuncture site, change needle position slightly, but do not probe around the site. Replace the tube with another evacuated tube in case first tube is malfunctioning and or is lacking in vacuum. Check for another site. Okay. Again, once the top of that tube has been punctured and the air begins to seep out, it is nearly impossible for it to get filled. For if blood enters it, it's nearly impossible for it to fill to the appropriate filling line. So change tube if necessary. You may have to draw, even if you that's why that's the purpose of using the discard tube first, to ensure that when the tube that you actually need gets filled to the appropriate level. Order of draw: blood collection tube, blood culture tubes, yellow closure, or blood culture valves. Coagulation tubes: sodium citrate, light blue. Your serum tube, with or without clot additives, with or without gel, red, speckled or gold closure. Speckle means like different colors. Those would be like red and gray, red and yellow. Glass non-additive serum tubes without a clot activator can be filled before coagulation tubes. Glass or plastic serum tubes containing a clot additive may interfere with coagulation tests. All right. So again, this will be at the discretion of your employer, the facility where you work. You have to know what tubes they're using to ensure that you are following the proper order of draw. All right. If it's a glass non-additive tube, you will without a clot activator, but make sure that you fill that first. The glass plastic tubes with a serum contain with the clot activator, again, just make sure that you fill them in the proper order. Right? If it doesn't have the additive, again, fill it first. Goes back to what I was just saying, because I don't want y'all to get confused. This is your basic red top tube with no additive. You'll fill that first. All right. If it doesn't have anything in it, fill it first. All right. And that's to ensure that, hey, I'm in this vein and that I'm going to get the proper amount of blood that I need. Your heparin tube, your green or speckled tube, or light green closure with or without gel plasma separator, EDTA purple lavender pearl closure with or without gel activator, uh, glycolic inhabiting tube, grade closure, potassium oxalate, sodium fluoride, uh, potassium 2, EDTA, sodium EDTA, and sodium fluoride or sodium fluoride only. All right, it's the BD vacuum container order of draw for multiple tube collections. Issues when filling tubes, additive carryover, additive anticoagulation in one tube should not come into contact with multi-sample needles as the tubes are changed. Avoid carryover by gently tapping tubes to remove additives to the bottom to move additives to the bottom of the tube prior to using them. Hold tubes downward during blood collection. If anticoagulant is inadvertently carried into the next tube, it may cause erroneous test results. Be attentive to fill rate and volume in each tube. Specimen identification and labeling. Specimens should be labeled adhesive and or barcodes immediately at the patient's bedside or ambulatory setting prior to leaving the patient. You don't want to be leaving. You don't want to draw the blood and then walk out in the hallway, or go to the nurse's station, or go down to the lab to um, label it, because these blood specimens are time sensitive. So if you draw the tube at 11 and it takes you about 15 minutes to get down to and the tubes have to clot for an hour. If you draw the tubes at 11, it takes you like 15 minutes to get down to the lab, and when you get down there and you realize that you haven't filled the tubes out, you haven't labeled them, so you write your name, your date, and you put 11:15 on the tube, you're 15 minutes behind. So guess what? So when you put 11:15 on there, whoever's working the lab is going to start the clock at 11:15. So now, after that, after the specimen has begun to clot for an hour, has clotted for an hour, that 15 minutes that have been added on, now the specimen is starting to break down, and that's why it's imperative that you label it right there at the patient's bedside. Here's healthcare worker affixing the label to the specimen tube should include the patient's first and last name, patient's unique identification number, date and time of collection, specimen type, ID of person who collected the specimen, essays to be performed, which is optional, patient's room number, bed assignment, or outpatient status, which is optional. Essays, it's another word for tests. I don't want you guys to be confused by the lingo. Tubes should not be pre-labeled. Ensure all information is complete and correct. Ask patients to verify information on labeled tubes correctly. Okay, so this is why you should not pre-label tubes. In the event that you get to filling yourself and you feel as though, well, I've had a 30-day no mistake draw, whatever the case may be, and so you only bring in the needed supplies. Okay, you feel as though that you're at the top of your game, you're the best. Now you only bring in a purple top. No, you only bring in a red top, blue top, and a purple top. And you label your tubes, but you grab them out of order, and that first tube that you grab, it'd be purple or blue, you don't get it filled to the line. So you only brought what you needed. So you don't have any extra labels. So guess what? Now we have an issue. Now we have to explain to the patient that, hey, I have to go get more labels, or I'm going to have to get some more blood from you, this, that, and the third. Patient's not going to be happy. All right? Never pre-label your tubes. I always do it right there at the patient's bedside. Again, extra added level of verification. Yeah, just to protect yourself. Here you see the healthcare worker verifying that information is on the tube is correct with the patient. Place a label on sample tubes in accordance with approved procedure. Document situation if unavailable to obtain specimen. Again, as I just referred earlier in this lesson, you will learn early on and quick that if it's not documented, it didn't happen. Caring for the puncture site, dry, sterile gauze is applied over puncture site with gentle pressure for several minutes or until bleeding has ceased. Patient's arm may be kept straight or slightly bent at the elbow. When bleeding stops, apply bandage. If the patient continues to bleed, a nurse or supervisor should be informed. And you're not trained to deal with that patient that may suffer from hemophilia. All right, that's excessive bleeding. Brain went blank there for a second. So here, the healthcare worker applying the band-aid on top of the gauze. Dispose of used supplies and equipment, paper and plastic into a wastebasket, needle and lancet into sturdy, puncture-proof, disposable biohazard container to be autoclaved or incinerated. Right, this is not something that you have to worry about. Did the lab the other day on how to properly dispose of biohazard. That is something that should be taken up by Stericycle or whomever, the area that you're working in, who's ever controlling their waste. Stericycle is one of the top brands, so that's what I'm saying. It will be Stericycle. Items contaminated with blood in biohazardous disposable containers used only once and discard. Breaking, bending, or recapping needle is not acceptable. Is not acceptable practice. Patient assessment after venipuncture. Check venipuncture site for 5 to 10 seconds to make sure bleeding has stopped. Apply adhesive hypoallergenic bandage. Ensure all tubes are properly labeled. Confirm identity of blood samples. Sanitize hands again. Remove hands. Sanitize your hands again. Excuse me. Remove or appropriately discard supplies and equipment that were brought in. Thank the patient. Other issues affecting venipuncture: coordination of lab requests to reduce duplicates. Keep a log of frequency and volume of blood collected. Monitor number of times patient can be punctured. Reduce volume of blood discard when using IV samples. Okay. Now, per the Joint Commissions, you are only allowed one opportunity to stick a patient, and then you will seek the assistance of another patient. But again, depends on where you go, where you work. Some places will allow you to stick that patient again, and if you missed 2 consecutive times, and then you are required to seek the assistance of another physician, another healthcare provider. But again, it's going to depend on where you work. So make sure that you are aware of the standard procedures within your company. Make sure you are operating in compliance with these rules, and we won't have a problem. Notify laboratory when multiple time tests are ordered. Assessment of stat orders for clinical necessity. Coordination of therapeutic drug monitoring among staff. Awareness of patient transfer to coordinate test requests. Hematosis caused by blood leakage into tissues. Insert needle at correct angle through upper vein wall, but not through lower vein wall. This is how you reduce hematoma. And see here, this is what hematomas look like. Stated maybe last chapter of how to respond to hematomas. And just to refresher your memory, because I'm pretty sure some of you could have possibly forgot, uh, or just didn't catch because you didn't watch the video. When dealing with a patient who has a hematoma, you can take your standard 2x2 gauze and place it over the site. If the bruising does not exceed that 2x2 gauze, then that site it is okay to use that site. If the bruising expands beyond that site, do not use that site. If the bruising of that site expands beyond that 2x2 gauze, do not use that site. We're going to look for an alternative site. If no alternative site can be identified, then the test must be rescheduled. Make sure you apologize to the patient, explain to them the procedure, like what's going on, why they have to be rescheduled, so on and so forth. Leave it at that. Hold needle device steady when changing tubes to avoid slippage out of the vein. Spoke about this already. Remove tourniquet prior to removing needles. Use recommended antecubital veins. Check for hematoma information during and after procedure. Apply pressure. Again, steps. Knowing the steps are imperative. Like you can reduce all of this, all majority of the risk. Again, not saying that these things won't happen because everyone's body type is different. But you reduce your risk of causing a hematoma, having the test results altered, whatever the case may be, by simply following the steps. Avoid use of 25 gauge needles. Avoid tourniquet applications longer than 1 minute. After cleansing with alcohol, allow site to dry. Because if you don't allow that 30-second dry time, if it's still wet, the chemicals in that isopropanol alcohol can be transferred inside the body. It's going to be on that needle tip as it goes inside the body, and as that needle becomes contaminated with the alcohol, and as that needle goes into the body and that blood rushes over that needle, that isopropanol alcohol is going to then be transferred into the tube. It's imperative know the steps. I cannot stress that enough, guys. I promise I cannot. That's why you've heard me say it so many times. Knowing these steps are imperative. This is where you make your money. This can make you or break you at the end of the day. Are you going to get promoted or are you going to get fired? Who knows the steps? Do not collect a blood specimen in a site that has a hematoma. When using a syringe method, attach needles securely to the syringe. Avoid pulling syringe plunger back too quickly. Again, that can cause hemolysis. You want to that's rupture of the blood cells, and we definitely don't want that. Pulling back too fast can also cause the veins to collapse. When mixing blood in tubes containing additives, gently invert them. We're not Harry Potter. We're not going to be, it's not, none of that. Wingardium Leviosa, it's not Cinderella, the fairy godmother, bippity boppity boo, none of that. It's a gentle inversion, kind of figure 8 type motion, infinity sign, and leave it at that. We're not gonna shake it. It's not juice with pulp from a vending machine. No, it's a gentle inversion. Say a figure 8 infinity sign motion that's going to mix the blood with the additives, which does not need to be done vigorously. Same rules apply. If any of you cook, you don't want to over mix your ingredients. Same things apply. It's the same concept. Identify discrepancies, requisitions, labels, names, dates, times, unlabeled or illegible, inadequate volume in the additive tubes, hemolyzed samples, samples in wrong collection tubes, improper transportation, chilled, unchilled, frozen, anticoagulated specimens, contains clots, use of outdated supplies, reagents, etc. Contaminated specimens, patient not instructed about diet restrictions, time sample drawn at the wrong time or time recorded incorrectly, prioritizing patients' time specimens. Blood must be drawn as near to requested time as possible. Monitoring medication, glucose levels, fasting, restrictions, uh, circadian rhythms, certain natural hormone levels such as cortisol also increase and decrease with time of day. And I spoke about this before. To give you guys, I want to put this into perspective because I think I'm not sure if I lost you all when I was saying that how the fats and like all the toxins rise to the top of your blood when you're asleep because you're doing a lot of stretching and things of that nature. Think about if you put oil and water in a bottle. Okay, when at its resting position, the oil is going to rise to the top or to the bottom. I forget. But once you pick that bottle up and you begin to shake it around, you'll see the oil and water begin to bind together and intertwine with each other. And that's what's happening in your body throughout the day. When you're asleep and you've done all this stretching, and when you stretch, antioxidants are being released into the body, so that makes the blood more healthier, things of that nature. So all the fats and toxins that has risen to the top of the blood. Now, once we get up and we start moving around and we get these things and we get everything shaken up, that's what's happening. Our blood is now mixing and mingling with all these toxins, and now they're being combined together. Time specimens, therapeutic drug monitoring, TDM, helps determine the correct dosage, prevents overdose, monitoring drug interactions, and helps prevent toxicity in drugs with narrow therapeutic window. Fasting specimens require blood to be taken from patient as a patient who has abstained from eating and drinking anything except water for a particular period of time. Fasting levels of glucose, cholesterol, and triglycerides used for diagnosis and monitoring. Um, Physicians consulted to determine whether a non-fasting level will be of benefit. Documentation then indicate that patient is non-fasting. All right, so tell the patient you get the requisition, say the patient is supposed to have been fasting. You go in and you introduce yourself. We're asking them questions to ensure that they have followed the procedure. They say, hey, well, I got real hungry, start feeling nauseous because I haven't ate. So I had a Pop-Tart, chewed some gum, whatever the case may be. You will consult with the physician and you would document what it is the patient told you. Patient said he or she had gum at whatever time on this date. Stat or emergency specimen. Patient has medical condition, that must be treated or responded to as a medical emergency or health crisis. Specimen must be drawn, delivered to laboratory, and analyzed without delay. Stat. That concludes Chapter 10 lecture.